of the foods that Americans eat, 90% of the foods that we eat are processed foods. That means that 90% of the foods that we eat are foods that did not exist 100 years ago. That means 90% of the foods that we eat are foods that the body doesn't know what to do with. That means 90% of the foods that we eat are foods that suppress our wellness, suppress our health, and create digestive distress. Is it any wonder why seems like we're falling apart at the seams in terms of our health? So you got to stay away from processed foods, especially processed sugars, processed flours, foods that have excitotoxins in them, foods that have preservatives in them, insecticides and pesticides. If she's doing fruits and vegetables, have her make sure she's doing organic fruits and vegetables, or she's washing her fruits and vegetables really well. And then she also wants to make sure that she's using nutrients that help her body process sugars and processed food, especially the B complex, the entire B complex. Get her on the BTT, have her sip on that. The Z Radical may be helpful. The Healthy Start Pack in general would be a great idea, but especially, ma'am, the Nightly Essence, which is an unbelievably important, powerful, and effective digestive support supplement. And she can also do fermented foods too. I don't want to sound like I'm always talking just about supplements. Food is very, very important. And in terms of probiotic-based foods, sauerkraut, miso, tempeh, kefir, pickles, apple cider vinegar, all of these can help with digestive flora, with bacteria in the digestive tract. Anything else, ma'am?
Well, and is there anything to do for the baby? Because the baby would be getting the antibiotics naturally, when they're...
The baby in the womb you're talking about, the fetus?
Right. Apparently they give it to you, the penicillin, right when the baby's being born to keep the baby.
Breast milk. Breast milk is a baby's best antibiotic friend. Anything make sure the mom's breastfeeding, first of all. The mom wants to breastfeed as long as possible. And anything that the mom does to support her digestive system, including probiotics, including whey protein, omega-3 fatty acids, all of that's going to pass through the breast milk and help support the baby's digestive health and wellness. That's really how nature has designed the system. Human beings get born with immature digestive tracts and immature immune systems. We're born early. But that's not a problem, because nature has set up a system where breast milk will accelerate the maturation of the digestive tract and of the immune system. It accelerates the development of the digestive tract and the immune system. So keeping the baby well fed on breast milk and making sure that the mom is not intaking factors that she's allergic to, because that can get passed through to the baby through breast milk, and making sure the mom is on a good nutritional supplement program, eating her fermented foods, getting her Nightly Essence probiotics, getting her Beyond Tangy Tangerine nutrients, that will all go through to the breast milk, and making sure, absolutely 100% sure, that she's getting omega-3 fatty acids with DHA and EPA, that is fish oil, which is very important for building the baby's brain and building the baby's visual acuity and building the baby's nervous system, both the central nervous system, the brain that is, and the peripheral nervous system, the nervous system that moves the arms and the legs and the periphery of the body. Omega-3 fatty acids from fish oil especially. Does that help, Julia?
Yes, I do have one more quick question.
Let me say one last thing before you go on. Zinc is also very important. Mom should be on 50 milligrams of zinc. Zinc is critically, and iodine also. Zinc and iodine are two very important minerals for building a baby's brain, building a baby's all of the glands of the body as well. So 50 milligrams of zinc a day, 12.5 milligrams of iodoral a day for moms who are breastfeeding. I'm sorry, go ahead, ma'am.
That's great. I also, when you're talking earlier about skin, I have a customer that has chronic canker sores.
Okay. Canker sores are a sign, and any kind of viral infections, canker sores, herpes, shingles, chicken pox, even any kind of viral infections that show up on the skin is a sign that the immune system is not doing its work. This is really, really important. It's not a skin issue per se. It's an immune issue. It's a defensive issue. Immune system is the defense system, and it's supposed to be able to handle viruses. You're not supposed to just get canker sores, assuming this is a canker sore that's a virally based canker sore. Sometimes little cuts will appear, and those aren't necessarily immune system reactions, but there's still problems with nutrition. But in terms of canker sores, you're looking mostly at viral infections. A viral infection and a herpes cold sore is the same way. A viral infection is a sign that the immune system is suppressed and compromised. So for patients who are getting canker sores or cold sores, you want to focus on immune building immune system building. There's a couple ways to do that. Number one, you don't want the body to have anything it has to deal with that puts a stress on the immune system, most especially sugar and processed food. Once again, correct any digestive issues, and then make sure that your patient or your client is getting immune-building nutrients. Vitamin C may be the most important of the immune-building nutrients. I'd be using 5 to 10 grams a day of it, a day of vitamin C in divided doses. You always want your vitamin C in small doses. Too much can cause a little bit of diarrhea. So for canker sores, high doses of vitamin C. Make sure your client is on 50 milligrams of zinc and on the ultimate selenium. Both of those are very, very important for the immune system. Selenium is powerfully antiviral, in addition to being good just as a general immune tonic, or having a general upregulating effect on the immune system. Selenium is specifically antiviral. 400 to 600 micrograms of selenium. Use the ultimate selenium from Longevity. 50 milligrams of zinc in addition to the vitamin C, very important for the immune system. Magnesium is important for the immune system. You'll get that, of course, in the OsteoFX. Just a general nutritional supplement program like the Beyond Tangy Tangerine and the Ultimate Daily can also be good for the immune system. And last but not least, the Z Radical is fast becoming one of my favorite longevity products, and that also is wonderful for immune system health. It has an ability to trap lectins. We talked about lectins a couple weeks ago, and viruses exert much of their negative effects via their sticky lectins, which allows them to adhere and stick to parts of the body. The Z Radical can wash away viruses, slime away viruses, if you will, and that can be helpful too for building the immune system. Does that help you, Julia?
Great. Thanks so much.
Thank you so much. I want to see if we can get Patrice real quick. If we can't finish up Patrice, we'll get you on our next Brightside episode. Did you have a quick question for us, ma'am? Patrice in South Carolina?
I do. Thank you for taking my call. We have a granddaughter that was just recently diagnosed with Raynaud's disease. She fainted last Friday. On Thursday.
Okay. Raynaud's is a circulatory issue.
Correct.
It has to do with how blood is moving through the body. Blood is not moving as it should. Whenever you have a circulatory problem, you're dealing with something blocking the flow of blood. When something blocks the flow of blood, the first thing you want to check on is inflammation that is entering into the body through a compromised immune system, somehow activating the stress response, which clots the blood and keeps blood from moving as it should. So for Raynaud's syndrome, first and foremost, look for digestive assault, correct any digestive issues. Secondly, use the B complex, especially niacin, which is wonderfully vasodilating, opens up the blood vessels rapidly. In fact, just niacin alone may improve Raynaud's. And then electrolyte minerals, potassium, calcium, sodium, magnesium. These electrolytes can also help. Use the Beyond Tangy Tangerine. Get on about 100 to 200 milligrams of timed release niacin. And then stay on the Healthy Start Pack. Of course, that's always a good idea. Thanks for your call, Patrice. And please call back up on Monday on our next Brightside episode, and we'll finish up if you have any more questions. I'm Pharmacist Ben. Stay tuned for Alex Jones next on most of these stations. We'll talk to y'all later, folks. Bye for now.